My name is John Calure. I'm a CV surgeon in Maryland, and I do a practice that's exclusively veins. We've been working with MD Connect for about 3 years, and it's been a tremendous boost for us. Well, in our practice, marketing is no small part of what we do, and the internet piece of that was a very important part of it. And we were not newbies at it. We were doing internet marketing and Google pay-per-click for 3 to 4 years before we got involved with MD Connect. So we had quite an experience in it, and we thought we had sort of optimized it and really gotten everything that we could possibly get. So when we got involved with MD Connect, I was stunned to see how much things had improved. So we'd actually had reduced our spend just by a bit, but we tripled our pay-per-click. So we really saw a big bump. I would say that the results we saw were pretty immediate. We could see a direct step up in the referrals, basically from the first month that we started. And we do extensive analyses regarding return on investment, and it was very impressive. You could actually see the transition point from what we were doing before, which wasn't bad in our own defense, but it really took a giant step forward. And the results have been consistent since that time. I think internet referrals are very high quality referrals because in our case you have a well-educated patient that's researched the problem, and it more directly connects you with the right sort of patient. In our particular niche, there's a certain cosmetic flavor to it, and we really don't want that type of patient. We want the patient that has the medical issue. So by having the correct campaign to connect you with that sort of a patient has been more beneficial for us. So I think having an internet campaign, it sort of selects a certain patient population. Number one, you have someone that uses a computer. You have someone that is somewhat tech savvy. You have someone that's health conscious. So that pre-selects a good patient. We've gotten a great return on our investment. We've kept our spend level pretty much the same, if not a little bit less than what we did 3 years ago, but our results have more or less tripled. So I think we couldn't have expected better, And again, I was I guess humbled a little bit because I thought I really knew what I was doing, and I think a lot of docs assume they know everything anyway. But to work with MD Connect, you really see that you don't know what you think you know, and you can always, there's tremendous room for improvement. So anyone that knows the power of the internet and the power of connecting should also know the power of optimizing those referral sources, and I think that's the strength of MD Connect.